Hello everybody, this is Dr. Phil here at Total Performance Physical Therapy. Today we are going to talk about ankle sprains. We've all had ankle sprains at one point or another. They can be painful, they can be annoying, and you can come to physical therapy to have us help you not feel that pain and to heal that ankle sprain. One of the things I'm passionate about is being a certified Mulligan practitioner. Basically what that means is I use mobilization with movement techniques to help heal my patients with any ailments they might have. With the ankle sprain, I have an excellent technique that has helped everybody I've treated with an ankle sprain. So understanding how the technique works, you kind of have to understand some of the simple anatomy. So we will kind of trade cameras here and we will take a look at my foot model's ankle, or should I say ankle model. So this right here is your fibula. There's three ligaments that can really be compromised when we have an ankle sprain. Most of the time it's your anterior talofibular ligament. A lot of times it's your calcaneofibular ligament. And you can even have your posterior talofibular ligament affected with an ankle sprain. If you look, we'll back up a little bit. Ankle sprains occur because you abruptly invert your foot. And as you can see, when the foot goes in like that, whoop, this ligament is abruptly tugging forward on that fibula. And this is the ligament that we most likely see a position with. Or sometimes the calcaneofibular ligament, again, that foot rolls in hard, it might yank the fibula down. So the technique I do is I will glide the fibula posteriorly or posterior with a slight inferior glide with motion and movement from the patient to help get that fibula back where it wants to be. So when I'm talking about repositioning the fibula, I'm talking very, very, very small, minute distances, millimeters. I'm not talking about the whole thing being yanked 4 inches. That would be catastrophic. And not what you would see in an ankle sprain. Just the slightest little displacement of that fibula can cause a lot of pain. Think of it as like you go to the beach, it's windy, you get a grain of sand in the eye. It's very painful, feels like a shard of glass is in your eye, but it's just a little tiny grain of sand. So when you have an ankle sprain, that little malposition of the fibula can feel like it's this incredible pain, and just the smallest displacement can cause a lot of pain because you're putting extra tension on things that don't normally have tension, and when the ankle moves, things are sliding and gliding in a way that they don't normally glide, and you sense that, your body senses that, and you feel the pain. So all I simply do when I do this mobilization with movement technique is I take my hand, I place it on the fibula, and I'm doing a posterior and slightly superior glide. And as you see, if you do it correctly, you'll take the foot with you because that ligament is pulling it. So once I have a good feel for it, good distance, I'll have the patient invert 10 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then what we do is repeat that for 3 sets of 10. And almost every single time I've done this technique on somebody that has suffered from an ankle sprain, they either have abolished pain where it's completely gone or it's almost completely gone. So the other thing I will do after I do this technique on an ankle sprain is I'll reinforce all the work we just put in with some tape to keep that fibula in place, because those ligaments are still lax, and we want to make sure that we don't lose all that effort we just put into it. So I use some stiff tape, there's not a lot of give to it. I apply the tape to the fibula in the same direction that I glided the fibula in. So it's going to be that posterior, slightly superior angle, and as you can see, I like to just apply a little bit of a glide there, come around, and it comes up. smooth it out. Most tapes that we use in PT are heat activated, so I'll rub the tape in place, make sure it doesn't go anywhere. I think this patient has lotion on her skin, so normally I would rub that off, but that's okay. You get the idea. And then I reinforce it with one more piece of tape. As you can see, if I just pull, you can see how that takes the foot with it. And then now, this is going to help keep that fibula in place after we did that minor correction to the positional fault. And as you can see, what's important to notice is you may be thinking, oh, what about my circulation? I don't want this tape to cut off my circulation. That's why this loop is not closed. You will still have good blood flow coming from the leg to the foot and back. So don't feel like this is a dangerous procedure to do because I'm going to cut your circulation off. That's totally not going to happen. This loop of tape is not closed, so it's not going to cut off any of the blood vessels. And if the patient moves her ankle inward, do you feel that tension, patient?
Mm-hmm.
So she can definitely feel that it's keeping it in place. If she really had an ankle sprain, she'd be like, wow, this feels great. And I swear, it happens almost every time. It's one of my favorite techniques to do. I love seeing ankle sprains. So if you have an ankle sprain or anything else, give us a call or stop by Total Performance Physical Therapy. I'm Phil. It was great talking to you guys.